Hello, this is Dr. Jeff Munn. There's a good article in our latest uh, journal of the AVMA looking at findings with 223 cases regarding marijuana or THC toxicity in dogs. What the article goes into is interesting initially, but digging a little bit deeper, I think there's actually more information that I like deeper into the article. So a median age, these are definitely young dogs. Historically, you're going to notice acutely neurologic, and we'll talk about what that looks like. Is a very good table down here further. Outside or at a public place or where there could be exposure. One thing that's interesting, which is common to what I would agree with here, is that most owners will deny exposure even if they know about it. So one public key point here that may be worth noting is your veterinarian does not care about your marijuana use at all. We just want to help your dog. So you don't have to feel like you need to hide that. Just let us know. You can say it in ways like, the neighbor may have had some or something. It really doesn't matter to us. We're not looking to call any law enforcement. We just want to get the dog over the thing. So the earlier we know, the better. Please don't feel like you need to hide that even here in North Carolina. Most all veterinarians really don't care about that use. They just want to help the dog. Some of these findings are interesting, and then I will tell you something that's always a bit more in detail and worth reading a little bit more into the article than this synopsis that we always get. So hyperthermia was noted, meaning their body temperature is elevated. Tachycardia was more common than not, and hypertension or a high blood pressure when it was measured. But that's also a little bit interesting. More importantly, the most common clinical signs were ataxia and hyperesthesia, which basically that's what our text would say. He looks stoned, a lot of head bobbing, gazing off, leaning to the side, almost wanting to fall over. But then if you startle them at all, they get hyper reactive to the startling. So that seems to be a very common finding there. Interestingly, and one of our doctors in our doctor's meeting commented on this, and I had noted it but didn't realize it was this. So about 50% of dogs actually have urinary incontinence with that. So that can be a small clue. The most common combinations were, as we talked about, with with the way that they kind of stand and look. What the assistants would say, he just looks stoned. They also noted, so this combination of ataxia, hyperesthesia, and urinary incontinence, if you put those things together, you get a very good likelihood of index of suspicion, along with being a young dog with some degree of risk of exposure should heighten your sense of awareness that there was, there's a higher likelihood. Then they report a couple of things when you do a blood panel that may be worth noting is that in a little over half of cases, they did note a mild increase in or hyperkalemia or increase in potassium. So that's and calcium, mild high calcium were pretty common. But really, other than the electrolytes, your lab panels are pretty much going to be normal. Okay, so let's dive in a little bit deeper. This talks about what it is and that we're seeing more of it and all that. So most of the time, these dogs were confirmed by a test with the human urine test. And there were originally 411 cases, but of those, 188 were excluded due to reasons of suspicion only. Test results were either slight positive, no known ingestion. So for different reasons, they excluded a number of the cases. A couple of things I did think were interesting. If you're a veterinarian and you have access to this, you can look at the breed types, but I didn't find that was that much worth going into. One thing that I did find that was helpful is the median time from ingestion to presentation was about 5.5 hours. The median time to positive urine screen, of course, that was done about the same time, so it's going to be 5.5 hours. 3.5 to 8.5. So usually when they present to you hours later, that has been enough time to form to get a positive test. So that's good to know. Most were developing symptoms within 4 hours, but were delayed, over an hour or so getting to the veterinary office. Majority were presented within 6 hours of the onset of the clinical signs, however. So here's where we get a little bit more into the meat and the potatoes with some of these heart rate things and stuff that's a little bit more interesting than that one line above. So the heart rate of 222 dogs, they measured their heart rates, respiratory rates, and temperature in 212. Blood pressure was only measured in 61 of the dogs, so that's worth paying attention to. And the median heart rate was 111. So the median heart rate was in the normal range. 129, there's a typo, it should be of 222. 58% had a normal heart rate, 70 to 100 beats per minute. So most are actually normal. However, when they were abnormal, tachycardia or a rapid heart rate was 37%, and it does, so you could even have a low heart rate. So don't know that heart rate, because most of the time it's going to be normal. That is not a keying in on factor. So I guess it's just something to be aware of when they report that in the synopsis at the beginning of an article. My first thought in some of these things when you read these articles, that's why it's worth looking into the details a little bit, is my thought is that saying that I should look for a high heart rate as a confirmatory thing with, hey, I have a high suspicion this dog may have been exposed to marijuana, and I think this is what we're dealing with. But then if he had a normal heart rate, I may begin to discount my hypothesis, when in reality, most of them have normal heart rates. Same thing with respiratory rates, body temperatures, also the same. Most all of them were normal. So those, if it was abnormal, the fact that you were hyperthermic. So most were normal again, 61%. If they had, of the ones that were hyperthermic, it was 22, but then of the ones that were abnormal, 16% were a little bit low in their body temperature. And similarly, we only measured 61 blood pressures, 37, so 60% were elevated, but the others were normal tensive, and only 3 were hypotensive. So, take that for what it's worth. And then I'm going to move down. This kind of goes through that whole table in a little bit more broken down fashion. I like the table pretty good. But this is what I thought was pretty interesting here. I like this table a lot because this has to do with what you're seeing in the neurologic status, and what can be gleaned from this table, I think, is much more helpful. So of the forebrain area, the hyperesthesia, agitation and anxiousness, and excitability, if you put those 3 things together, that's your big components. Most all of these dogs, 75%, had hyperesthesia due to some forebrain changes due to the THC and agitation. So that's pretty much the big deal. The other category is the vestibular apparatus. falling over, leaning to one side, and head bobbing. So we see these 3, 4 things right here are probably our biggest indicators. They also are depressed mentation wise, so they seem lethargic. And then you can have dilated eyes or pinpoint eyes, but of the two, there's a higher likelihood that your eyes are going to be a little bit dilated. Falling asleep, difficult to arouse, decreased responsive, dazed and confused. Okay, guys. Depressed mentation. If you look at these 3 things right there, they are all relatively similar encompassing. So a lot of this is observational. Tremor, shaking, twitches. Again, that's very high. Collapse is not going to be a good thing. That's more of a problem when you're getting into much more difficult issue at that point, it seems like. But those are the big ones. And then finally, ataxia, urinary incontinence were really high. The other ones are, anything below like 7%. I wouldn't pay much attention to those, but ataxia, urinary incontinence. So if you put those 3 big categories together, hyperesthesia, agitation, falling over, leaning to the side, depressed mentation, and if you have any urinary incontinence, then I think you're on par with higher suspicions. If you do a blood panel and everything looks normal, then this table is very busy and it's not that helpful. I think the 2 things that they noted were the potassium being increased more often. Well, that's 51%. I mean, most were normal. None were low, so that's kind of worth noting. And I guess if you see this elevated along with leaning on everything else you got up there, I don't know that these electrolyte things that they highlighted in the study are that helpful. Maybe the ionized calcium, but how often do we do ionized calcium? Most of the calcium we do is just total calcium. So I would love to see more of a usable thing here. So if it's ionized, I don't know if that correlates. But if you do ionized calcium, if you have an iostat or something and you do that regularly, then 80%, so that's more impressive to me, had an increased ionized calcium. What does that mean for our regular calciums on our regular machines? I don't know. And then finally, the last thing that I'll cover is most did not require any treatment, and those that got treatment were typically either, some subcutaneous fluids that we give under the skin or an antiemetic if they were nauseous. IV fluids were usually not necessary, but were done in 10% of cases, and hospitalization just to monitor them in most cases was a lower percentage there. I think in the end they did say that all these dogs recovered with no problems, and there was a point in here where it did talk about how long they were hospitalized or the time to recovery. I recall it being less than 24 hours. They were considered back to normal in almost all the cases. See if I can find that one point, and then we were going to close this guy out. Okay, I did get back to the final treatments and outcome as we went through supportive medications for most. And I guess there were a couple of dogs that had seizures, so they were given midazolam or another seizure control medication. One dog was given phenobarbital, so those are the seizure individuals. The median length of hospitalization was 24 hours, so they usually stayed around 24 hours, with some staying up to 3 days. But all dogs survived, and a few had follow-up examinations, and all clinical signs had resolved. So in most cases, within 24 hours, they're back to normal. More severe cases, or for whatever reason, there were a few that were followed or kept hospitalized for 72 hours. So that concludes a review of this recent article that I thought was interesting from JAVMA. I hope you found this helpful to some degree. Let me know what you think. in the comment section. And if you're interested in these things, I will try to find more of them when they come to light that look like they may be somewhat interesting.